If you're experiencing debilitating pain during your menstrual cycle, it may be time to ask your doctor about endometriosis. Endometriosis is a disease where tissue similar to the lining of the uterus grows outside of the uterus, causing severe pain and sometimes infertility. Dr. Dorita Francis Phillips hopes that more women and girls will listen to their bodies before it's too late.
So I think we want to use Endometriosis Month, March, to promote awareness, to inform our young ladies, to inform our moms, to inform our school teachers, to inform our principals, to inform basically all of our young ladies that you do not have to suffer with the symptoms of endometriosis, and that severe cramping abdominal pain, whether on your cycle or not on your cycle, may actually be an indicator that something is not quite right and it should be evaluated.
Dr. Francis Phillips has found that more and more adolescent girls are receiving this diagnosis. Unfortunately, there is no cure for endometriosis, but it is a treatable condition, and the earlier you're diagnosed, the better.
Early diagnosis or early assessment or clinical diagnosis affords us early care, early treatment. And that in itself will, of course, as we can understand, will help to alleviate some of these symptoms and can actually prevent the progression of this disease. It may not be we may still have some women who are suffering with infertility, and so we can actually get to managing these patients earlier rather than losing a lot of time for the infertility aspect of things, and we can give them options.
Now, according to Dr. Francis Phillips, it could take a woman years to get a diagnosis of endometriosis because symptoms align with many other conditions. She warns all healthcare providers to keep this particular condition in their minds at all times.
I would like to use this opportunity to even speak to my professional group of physicians, our general practitioners or our primary care physicians, to always have endometriosis in the background. So if you have a suspicion of endometriosis, then most likely these patients, being a differential diagnosis for patients with certain conditions, these patients may be evaluated quicker. They can be referred quicker to a gynecologist, or even our primary care physicians can actually start treatment for these patients.
Dr. Francis Phillips will be hosting a virtual lecture for all those interested in learning more about this condition next week, Thursday. And as a recent addition to the National Health Insurance's physician list, she continues to encourage all women to get their yearly checkup. Tyler Simonet, Eyewitness News.